As an interventional cardiologist, though, Dr. Quesada, I want to know what it is that you do, what is your background, and how are you saving the world one heart at a time?
Thank you. So interventional cardiology means that's exactly the word, intervention. We go inside the heart with catheters without doing any cutting. And with these little catheters and balloons and stents and all these devices, we try to repair or liberate obstructions inside the heart and in the coronary arteries. And it's a new specialty. Actually, we just completed 40 years since the first coronary angioplasty was done. And actually that, when it was presented the first time in 1979, was here in Miami Beach at the American Heart Association, Andrea Grunzig. He was an interventional radiologist from Germany who did the first coronary angioplasty in humans. And he presented his abstract here in Miami at the American Heart Association meeting in 1979. And from that, a new field came up, and like fire, you know, it's in 40 years.
Opened the doors to so many advances.
Opened the doors to so many advances, in which you still, I would say, in the structural part, we're in the infancy, but the future is very bright.